just because I know we've had a slight change of circumstances this morning, haven't we? Caroline had a little bit of a panic when one of our speakers wasn't able to join us this morning, and we wanted all of their fabulous information to reach you all. So we amazingly, Brenda at the very last minute has joined us from Arun and Chichester Citizens Advice. So I will do this first bit as Danny isn't with us, and then Caroline, if you take over for the rest of the meeting, that'd be fab. Great. All right. So first up, we've got Brenda joining us from Arun and Chichester Citizens Advice, and we wanted to give you a little bit of information. Some of you will already be aware that for the last 15, well, it's coming up probably 18 months now, we have been delivering something called a Carer Energy Wellbeing Project, and it's funded by Southern Gas Network, and it's actually been really helpful for carers as a vulnerable group who might have more need of electricity than other cohorts when there's a power disruption, or they might actually be struggling with the cost of living because carers typically will be more likely to be struggling with paying for their bills in this context of a cost of living crisis and be experiencing fuel poverty. And similarly, with a lot of older people, their homes might not actually be adequately set up for both energy efficiency, but also for safety around carbon monoxide and for having the appropriate plugs and outlets and all sorts of things that can come into the context of energy safety. So we found this partnership working with Arun and Chichester to be incredibly beneficial to ourselves and our own knowledge, and also to the carers that we support. And we have had, in a smaller scale, we've had that funding continued for the next 2 years, and we thought it was pertinent and relevant for all of you guys to have a bit more information about it, because all of the carers that you are supporting within your surgeries may well benefit from some additional energy information advice from either ourselves or Brenda, and thinking particularly about things like the Priority Services Register, but also, you know, Arun and Chichester Citizens Advice can provide a much broader envelope of support around debt management, dealing with the gas companies, and a whole range of energy support and home safety support. So what I've asked Brenda very last minute to do, and I will send Danny's slides, who was due to be with us today, so you do have that information, but I've asked Brenda just to come along and talk about some of the types of support that they can give to carers, so that you can understand what is available and how it can benefit the patient cohort that you have in your GP surgeries, and then also how you might want to refer either into us, because we obviously partner with ACCA on this work, or direct to ACCA. So Brenda, if I could introduce you and ask you to have a little bit of a chat with everyone about the types of support that you guys can provide to carers. I am conscious this is targeted at carers, but I do know you do a lot of broader energy sort of advice for other vulnerable cohorts. So if it feels relevant to mention that, please do. Otherwise, just keep it targeted on carers for the sake of this conversation. All right, thanks very much, Brenda, and I'll put myself on mute now.
Hi everyone, I hope you've had a good start to your day. I have a little presentation I'm going to share with you, but I am going to whiz through a few of the slides to focus on the areas that will be something that would probably crop up for yourselves more, and give you an idea of when to refer somebody to the energy team, and what they can expect when they come through to us. So let me share my little presentation with you, and just bear with me as some of the slides I will just pass. Not had time to chop those out, so I'm hoping everyone can see my screen.
Yeah, we can see that, Brenda.
Lovely. So want to know who can you give energy advice to, or who's suitable? So we talk about who might be more at risk from energy advice. So these are the things I will cover very briefly. I've got about 10 minutes, haven't I, Anna?
We've actually got up to 20, isn't it, Caroline? I think it's 20 minutes we've got allocated. So you've got
Okay,
about 20
lovely.
minutes.
Okay, let's crack on then. So these are things we'll be talking about today. So first of all, what is fuel poverty? There is a sort of set statement that classifies when somebody's technically in fuel poverty. So that's when somebody needs to use more than 10% of their income to keep their house at a satisfactory heating regime. The World Health Organization recommends that's between 18 and 21 degrees. So when they speak to our energy team, we do talk about heating, what's best for their property, and we are mindful that not everyone we speak to can even manage to achieve 18 degrees because of the cost of living, the financial constraints. So we're very mindful of everyone's situation, and we see such a range of people come through the door. So we'll be sensitive when we talk about these things. And just to add in there, currently there's 2.36 million households in fuel poverty. That's a lot of families that this affects. The children as well. It's not just the bill payer, it's everybody in that household that will feel the difference and will struggle. So who's most at risk? Who might you be talking to that you think, wow, this person ticks these boxes? They already mentioned things about struggling to afford their heating. They're on a low income, I can see that. So we've found that through research, it is single parent families that do come up with the highest rate of fuel poverty. This is the low income. There's one income coming in. We've also got a few others, those Anna's mentioned, and you deal with predominantly health conditions, disabilities, whoever is in the household. There is a greater need for energy all year round for a lot of people. For many, we think, oh, summer is a time of year perhaps when don't need energy advice. Why would I need energy advice in summer? But for many, summer is just trying to catch up after the winter. Summer is it possible to build a bit of credit because I'm worrying about the future winter because my health has just changed or my conditions have got worse. So there's advice we can provide all year round, and we tailor it to the individual, their setup and the time of year as well. So young people who are renting, first time in their property, never had bills before, don't know where to budget. There's a lot of fluctuations, there's a lot of changes to get used to. So they would really benefit from energy advice. There'll be many things they don't know. My daughter moved into her own property 2 years ago now. And the first thing she was asking is, what are these smart meters? What do they mean? What do I need one, Mum? And she's found them really, really useful. She's got the in-home display device that I don't have, so she's sort of mentioning bits to me, and I can really see her learning from it and from the conversations that we've had. So first time for some people, really, really, really good to get that energy advice. There's also a lot of households in this country that are energy inefficient. So whether they've got no wall insulation, no loft insulation, very old heating system, single glazed windows still, there's lots of reasons when you're using energy. Maybe you think, you're affording it through some parts of the year, but other times of the year, it doesn't matter what you do budget-wise. It doesn't matter what you do with energy saving tips. Your household is inefficient and it's going to lose that heat no matter how much you're putting out or how you arrange it, what setup you do. And that's where we can look at advice, because we look at the structure of the property, how you could go about improving it, and are there grants? Is there help to improve it? So we talk about all those things. And lastly, rural areas where often they're off the gas grid. So, what are the alternatives? What tips are there? Where can they do that? Often there are networks that people are off the gas grid can connect to, where they can buy in bulk together, and then it creates a cheaper way for them to buy the fuel that they need. So we can go through that with people and support them to look in the area and find places like that. So those are all the people that would benefit from energy advice. And I think that's pretty much 95% of the population. There's always something, whether it's your health, whether it's an income change, whether it's just getting your household as energy efficient as you can get. There's all the low carbon technologies that are coming out, the solar panels, the air source heat pumps, and so it's constantly upgrading and looking after your property. And so I've got a few little examples here of when energy advice is good to bring up in conversation. So if somebody is talking about budgeting, debt, cost of living, money worries, then you know we've all got utility bills to pay. Energy is one of them. So it's not something you can choose, well, I can cut that out because I'm going to live on these other things. It's one thing we have to factor in and we have to manage with our bills and how we budget and pay. The other thing is often we found that if people have water debts, if they're talking to you worrying about their water bills this time of year, lots of people there's lots of talk about water at the moment, isn't there? Bills have gone up, Thames Water, Southern Water, I think everyone's had an experience there, but the energy debts tend to go hand in hand with the water debts. So if somebody's talking about their water concerns, it's quite likely they're struggling to afford their energy or already have an energy debt. So people, when they talk to you about their housing, if they mention there's damp and mold, if they say they've got a cold home, or in this time of year, if they say their house is really hot, this is when energy advice is useful. We can provide tips on how to try and cool it, or in winter, how to try and warm it. There's science behind the damp and mold and how it lands where it lands and looks the way it looks. We can identify what the cause is. And then there are ways to talk then about improving the property. But if they're mentioning housing issues, their bills are likely to be a lot higher because of these issues. Then food as well. Food's another big thing. Many people are struggling. The food banks, there's wonderful charities out there, food banks, apps you can get on your devices, local places that are all supporting with food. And the people that come here, they will usually have other struggles as well. That's debts in general. That often includes the energy and the water. And as you know, health conditions, disabilities, people are coming in, they've got a new health condition or something that's been lasting, they've been struggling to cope with for some time, and things have started to slowly get worse. And once that ball starts rolling, it's really hard to stop it. It's really hard to put things in place to support them. So the earliest opportunity to get them the knowledge that will help them moving forward. Do have a little discussion, mention energy, see what the reaction is. You know where the team is, and you will know what sort of support they can expect from it. And also, like I said earlier, lots of changes in the way we use heat in the government are trying to encourage people not to use gas anymore, to move away to other sources. Electricity is still more expensive than gas. So, what other ways are there to heat your house without using gas? How to make your house more energy efficient so you're trapping that heat in winter and you're keeping the hot air out in summer. So we talk about home improvements. We also talk about appliances. These can start to use more energy if they're inefficient. Where can you go to get a different appliance if you're struggling to afford costs? And if you're thinking, right, I have got that finance, that finance is set aside, I want to improve the property, where do I look? How do I start? What am I going to do to identify the appliances that are going to be right for me? We can provide information on all of those things as well. So next one, these are the things we're talking about. We help people to understand their bills. Many people get a bill, don't read it, because they think, I really don't know what's on there. I don't understand how they work the kilowatt hours out. I don't even know what they mean. What's a unit rate? What's a tariff? I'm not even going to look at it. I just know the figure I have to pay at the end of the month. but understanding your bills and actually just taking time to look at them, will start to notice certain things. We can support people to look at certain areas. I'm not going to go into science and the maths of how to work out those kilowatt hours for your gas. It's what to look at that's easy for people to do without understanding those things. So we'll go through those with people. The main thing is looking at your tariff. Big way to help reduce your costs is keep an eye on the tariff that you're on. All energy bills will tell you if there's a cheaper alternative that they offer. And it might be a different setup, but it mentions something on the bill. So it says you might be on our cheapest available tariff. Well, it's good to know. But it might say you could save 75. I've seen bills where people are showing me and they can save like £300 across a year if they change their tariff, but they just not used to looking at the bill, don't notice those bits. So much on there to look at. So the tariff is the main thing you can do. Are your meter readings getting to your supplier, whether you're sending them yourself, whether you've got that smart meter that provides them for you? A quick glance at the page 2 or 3 of your bill. Many people don't look past page 1. You'll see, oh, actual readings, brilliant. I know my bill is accurate. If it starts to show estimated readings, well, then you can see your suppliers had to work out what they think you're using. It could be quite different to what you're actually using, especially if you're trying to be really energy efficient and you're feeling frustrated that you don't see the bills going down. Maybe it's because they've been estimated. And the other thing we notice, when people have smart meters, they think, right, I don't need to do anything. They're all working for me, sending readings. I don't need to worry about it. You don't need to worry about it, but it's good to glance at your bill because there are times when your smart meter won't provide that meter reading. There's an interruption to communications. There's a little comms hub by your electric meter that sends the readings to the supplier. That may have been interrupted for some reason. The next time they've generated your bill, they haven't had a reading in, so they've had to estimate it. So it's good to just keep an eye on that. Has that happened once, twice? Oh, maybe that's okay because the next bill it catches up and you think I can manage that. Some people, though, are really budgeting down to the wire. They need to know what they've spent. They need to know that they're paying the exact amount of money, not more, not less, for their bill because the rest of their finances have got to be directed elsewhere. So this is when it's good to have a little glance. Sometimes that smart meter doesn't provide readings, and our team can talk to people more about smart meters, how often it can send readings, what you can do about it. We can support people to contact their suppliers if there's problems. There have been occasions where a bill has to be estimated for a couple of months, and then suddenly somebody's saying, hold on, I've got 2 bills this month and I wasn't expecting it. Maybe they didn't check to see that the smart meter wasn't working, estimated readings were provided, and then the smart meter started working again, and suddenly there's a catch-up bill. So that's something suppliers can send. But if you do check your bill each month, you're more aware of what's happening with your account. Do you need to say something to your supplier? No smart meter reading this month. Is everything all right? Often you can go on your app online, you can do web chat. There's lots of ways without having to sit on a phone call to contact suppliers. So we talk about all of those things to do with your bill. And the biggest thing I can also suggest is look at the balance on that first page. If you've got a direct debit set up, is your direct debit covering your usage so that your balance is always quite low? You may be a little bit under, you may be a little bit over on your balance, depending on the time of year, but we can talk to people to help them understand why that is and what the benefit of that is. But just keep a little eye on the balance. I don't know how many people actually check it. They think money's coming out of my account every month, it must be fine. We'll talk to people about how often suppliers double check those direct debits, and there's a process for all of those. But helping to understand them means you're aware of what's going on. So if anything crops up, then you already know what it might be, or what to do about it. We talk about home improvements as well. Where do you look? How do you understand the property you're in, especially if you don't own it? So if you've recently bought property, you'll probably get your energy performance certificate with it. These days, when you take on the rent of a property, you get an energy performance certificate. Most people don't look at it. They just go, yep, thank you. I really need to move into that property. I've got so many other things to consider. Moving is a really stressful time. But we can help people to understand that certificate if they've got one. For those who are homeowners and perhaps really struggling with costs, we do have a lovely lady on our team that can actually produce these for people who can't afford them themselves. So that's a really good starting point to work out what is it about your house that could do with some work. And then from there you can look at, are there grants and funds? As criteria for all grants and funds, some of them are linked very much to your health conditions. So it might be that through your health conditions, you would be eligible for some kind of grant, whether it's to improve the loft insulation, cavity wall insulation, and might be changing the heating setup if yours is broken, you haven't got one. But there's lots we can talk about that, and it's a really, really good way to reduce your bills. It takes longer for you to see the benefits, but especially if you're a homeowner or you're renting and you've got that long-term rent, then it is in your interest to follow that advice to see what you can do with the property. We talk about heating. Everyone's heating is different. It's whether, do I leave my heating on low all the time? Do I turn it on a timer? Do I switch it on when I need it? It very much depends on the property that you're in. Have you got solid walls, cavity walls? So we talk about all of those things to help people get the best from their heating. Really important in winter time. Obviously, nobody really wants to talk about heating at the moment, but we've got the opposite effect now. If you've got a really hot house, how do you keep cool? Why is your house so hot? Lack of insulation can mean that heat is getting in. And, you think, why would I need insulation in summer? But we can talk to people about how to look after their property in summer. What are the best energy saving tips for summer? And we can do the same for winter. And like I said earlier, we help people to look at their appliances, work out how much they're using, how to test things if you think something's going faulty, and support them with that. We've got loads of tips. We can give out tips that save you £350 a year if you follow them. So there's lots of ways to make savings that we can go through. Like I said, we have a home visiting team. So we've got people that can come out to your property. They can walk around and look at the areas you want to point out, whether it's that damp and mold. Why is it in that corner? I've done everything I can think of. I ventilate. I do all these things. It's still there. We can talk about all of those. So we can support people by coming out and looking at their issues. Lots of people aren't digitally active. They're perhaps not confident at sending photos or interacting down the phone. So this is when a home visit is really useful. Can you please look at this bill or look at this area? We've got teams who can do that. We deal with complaints with suppliers as well. If you're unhappy with your supplier, you've tried to contact them, you've got the energy advice and you think, right, I've really looked at that. I still don't understand why my bill says XYZ. Well, that's when we can talk to you more about it, support you to make a complaint if that's what you like, give you information about what you can complain about and how to do it if that's all you need. We cater for every level out there. So I deal specifically with the complaints and things with suppliers. So I do three-way calls. I email on people's behalf, those who just can't manage that kind of interaction. So we have a really good package, a full range. And we also look very much at the support that is available. I know the household support fund is finished, and a lot of people are like, where do I go now? What is there now? I've relied on it for the last few years. We've had many people that have come back year after year, and it's been a really important supportive part of their sort of year when it comes to energy costs. So where do you go now? What support is there now? What can be done? So we talk about all of those things. So there's a really broad range of things that we can do. People can be referred in. We've got a free cost of living phone line people can call. Even on an advice line, national advice line, we've got a lot of people, our energy advisors are hopping on there to help get people some energy advice when they come into us. We have an email address. People can email us. There's lots of information on the Arun Chichester website where people can have a look at that can tell you more about how to get in touch and what to expect. So we're going to pass through the next ones. Got lots of tips about summer and winter. Like I said, in summer, people are often dealing with winter debt. And so it's not a summer of, oh, I can ease up on things. I'm still paying as much per month because I'm trying to catch up with winter. And I think we've been through all the rest of those, so I'm going to pass by that one. We're going to focus very briefly on the carbon monoxide awareness. It is odorless, colorless, tasteless. And it's really important that you get those carbon monoxide alarms in your property and test them every month. You should have one by every appliance that uses gas. Carbon monoxide is produced when appliance uses gas. It's when it escapes into the property that there's an issue. And testing that alarm monthly will really help. So symptoms are when the whole family is feeling really lethargic. Why is everyone so tired and sleepy today? Along with that, you will have headaches, nausea, vomiting maybe. Extreme cases, people may pass out. So it's incredibly important to have that carbon monoxide alarm, to test it, and to be aware of how everyone is in the household. Can easily be mistaken for a virus or something else. So if you take everyone outside on a walk, within half an hour, you're all feeling a lot better. Well, that's an indicator that perhaps something's not right in the property. So there's a phone number to call, National Gas Emergency Service, if you believe there is a leak and you are to get out of your house immediately, and call that number. I did that when I just moved into my property. Didn't do this job, didn't really know what to do actually. I had guinea pigs and I just scooped them off my top and I ran outside and I sat on the lawn outside and I phoned my estate agent because a renter and I had no idea what to do. So they were really good. They're really helpful. But that's why it's really important you know what to do ahead of time, just in case the issue crops up for you. We also talk a lot about scam awareness at the moment. They're getting better. Scams are getting more and more sort of high tech. It used to be you'd be like, oh yeah, there's quite a lot of spelling mistakes on there. I've never heard of this company. As an email, I'm just going to pass by. But I think now they're finding new ways to try and target people. When the energy grants that the government had available for people to improve their properties, when they were out, somebody might come knock on your door. Yeah, I'm part of the scheme. Our company is such and such. Yeah, you might not have heard of us, but we're working with the government, or we're working with the local council. That's one we've heard. Oh yeah, I work with your local council. That's why I'm in your area and I can do this. I'm only in the area today. They try and pressurize you. So we'll talk about that. How to notice things, what to do about things, where to look, what to do if you do need work done and you want to get some advice. So we can talk more about that one. Safe and well visits. I don't know if a lot of people know that the fire brigade do those. They come to your house. They'll look for trip hazards. They'll highlight any areas that might be problematic. They can make an escape plan with you if there is a fire in the property. I'm upstairs, so I don't have a garden you can nip into. I've only got one entry and exit point on my property, so it's something that would be really useful to get done. And there's lots of things they can do for you. They can help test appliances, put in smoke alarms. I believe they can provide carbon monoxide alarms. So that's a really good option to get somebody out looking at that property. They might notice something you've not thought of. They might manage things in a slightly different way, so you're not overloading one particular plug socket. All of these can create real problems in the property. So that support is there. Make use of it. The other thing Anna mentioned, this priority service register. So many people can be on the register. So it tells your supplier more about your vulnerabilities. And therefore they know they can tailor their support to meet your needs. So yes, primarily it's there for if there's an interruption to your supply, because it marks your house as a priority household and gives you a 24-hour phone line to call to get updates for when things are back on. Because lots of people will have electrical equipment they need plugged in. So, but they can do much more than that. So it's really good to tell your supplier about your needs and your vulnerabilities. If you've got children under the age of 5, if you've got health conditions, if you're over pension age, if you've had a temporary change to your circumstances, such as a bereavement, loss of a job, a new health condition, you are eligible to be on this register. And it can do a lot for everything from that 24-hour phone line to people providing you with water, to charging points, to contacting family members, to contacting British Red Cross emergency services. If you're out for days, I believe that in some circumstances they actually provide alternative cooking equipment if you can't get out the property and you've got no one to support you. So it's a really good register to be on. It just sits there in the background, but if there's an issue, then they know how best to support you. So where to look, we can support people to find where the best place is for their circumstances to get the support they need. And big one is energy companies. They have hardship funds, they have energy saving incentive schemes a lot of people don't know about. The British Gas has half price electricity on a Sunday. What's not to like about a bit of batch cooking or getting all that washing done? If you have to use a tumble dryer, use it then. But make use of your energy supplier. There's many suppliers out there. They all offer different things. Well, why not keep the market competitive and make sure you're with the supplier that actually suits your needs? So we'll talk all about that and help people to decide. We cannot tell people, though, what tariff they should be on, and we cannot tell people what provider they should change to. I think a lot of people go, just tell me what's the cheapest tariff. It doesn't work that way because everyone's lifestyle is different. Everyone's needs and setup are different. So we can provide you with information. We can talk through all the tariffs because they can be quite confusing. But if somebody's thinking they're going to tell me which one's best, we can't do that specifically. So some people ask that one. So these are just my little summary points. I'm just going to whiz through those because I've gone through all of those and leave that screen there. This is the things our energy team can do. So thank you very much for listening. I hope it's given you some information. To somebody says, well, what is energy advice? I don't really need, I know to switch my switches off at the wall. I do all of that already. We do so much more. And if you can give that person that little extra tip of what other things we can do, they might just go, actually, yes, actually, I could make some savings. I could do with that advice. And we're there for that need. So thank you very much.
Thank you very much, Brenda. That was really helpful and thorough. And I heard this myself last week, so I do think it's useful for all of us actually to have this information. Thanks, Leslie. We're going to take questions in a moment. I just wanted to check because here we've got on that slide you had the telephone number for queries through to yourselves. Do you have, signposting is obviously an option, but do you have any referral routes that our GP surgeries could use if they think that one of their patients would benefit from your support?
On our website, on the Arun Chichester Citizens Advice website, there is professional referral section. So you can refer somebody in that way.
Brilliant. Are you happy just to drop that link, not necessarily now, but before you go, just drop that into the chat so people have that as well? That would be great. And just on a personal level, when we've found with carers that we've been engaging with that the priority services register is quite a good gateway to broader conversations about energy. Lots of carers might not think they're eligible for this kind of support, but actually do really benefit from a conversation about how they are utilising their energy or about the safety of their home. So it can be really helpful to talk about the priority services register as the first step towards those wider conversations. And actually being at a couple of in-person events, we found from carers that have registered, where there was all of those water problems recently, or is it that recent now? But anyway, that those carers that were on the register had priority water delivered, had really positive experiences of the priority services register during that situation. So I think it's actually just it's a no-brainer really that a lot of people aren't aware of. So I think it's very useful to share that a lot of your patients will be eligible for the Priority Service Register and not be aware that it is available to them and the benefits it can have for them. Okay, so I will just go to questions now. Leslie, you had your hand up. You there, Leslie? I think we might have lost Leslie. Or you're on silent, Leslie. Okay, does anybody else have any questions for Brenda before we move on? Oh, okay. Caroline, I will hand over to you and I will switch myself off. Thank you very much.
Thank you, Anna, and thank you so much, Brenda. Yes, so our next speaker is one of our colleagues at Carer Support West Sussex, so Stacey Hall-Smith. Her job role is Carer Funds Wellbeing Worker. She works in the North team. So I'm going to hand over to you, Stacey. I think you've got a little presentation that you're going to share with us. So the spotlight's on you.
Hello. Hi. So I am Stacey. Let me try and see if I can share my screen here. Can you see that?
Yes, we can.
Yes.
Yeah.
Brilliant. Right. So I'm Stacey. I am Carer Funds Wellbeing Worker, and I'm in the north of the county. So I cover like Crawley, Mid Sussex, Horsham, and Chichester kind of area. And I do have a counterpart in the south that does the same role that I do. So with Carer Funds, so initially the role was to help to distribute household support fund, because that was one of the main things Carer was coming for, to get some help towards basically everyday essentials, bills, moving. It kind of varied what people was using the household support fund for, but that's no longer available. So the equivalent sort of is the crisis resilience fund. However, that is not as generous, I would say, as household support fund was. So with that, they are making sure that people are really in a crisis situation before they have access to the crisis resilience fund. But we still have access to the Carer Trust Fund, which we still make applications to. And that is usually for things, for example, if somebody needed bedding, or they've moved and they needed, bits and pieces in the household, or they needed to replace something but couldn't afford it, and that sort of thing. But what I would do anyway is go through the application with the person to see if that trust would be able to provide what they needed. We also have the Carer Health and Wellbeing Grant. So with that grant, that one's for the carer. So it's for the carer to do something for themselves that they can't afford to do. So the first time they access the fund, it will be about £300, and that's something that they can access annually. So with the Carer Health and Wellbeing Grant, carers would do stuff like have like a mini break if they're able to have a break from their caring role. They're able to join a gym if they can't afford the gym membership, swimming lessons, kind of go away. We've had people had like a trip to London to see a play and bits and pieces like that. So a day out and stuff like that. We also look at other sorts of funding. So for example, depending on what the carer will have a full exploration with the carer, and depending on what their need is, we will kind of be able to try and match funding to that. We don't always have funding specifically for certain things. So for example, if the carer is saying they need food and that sort of thing, we might not have any funding to be able to give them food, but we will probably signpost to the local authority so that they can access food banks, or some organizations will be able to give food vouchers and bits and pieces like that. So we will try to do that. And next, so the offer. The offer. So what we'll do is we will do a full exploration with the carer. We would provide information and support to the carer. We'll also do wellbeing conversations. Sometimes the carer will, the initial reason they will speak to us is because they need some funding and that sort of thing. But sometimes they just kind of want a listening ear or somebody to kind of be able to vent to a little bit and that sort of thing. So we, as wellbeing workers, we kind of make sure they are aware that we're here if they just kind of want to have a chat. Sometimes their, family members or people could be tired of hearing the same thing or a bit judgmental and that sort of thing. And they know that if they're speaking to us, it's a safe space, for them to vent if they need to and that sort of thing. So that's what we'll do. We also refer to other teams within the organization. So we have a welfare benefits team where if I'm speaking to someone and I realize that they could possibly be getting benefits that they're possibly entitled to, but they're not claiming, or if the carer is kind of struggling and probably would need a carer's assessment, we would mention that to them as well, that they can do that. One lady I spoke to yesterday, actually, she was saying, I really want to put some boundaries in place with the person that she's caring for, her mum. And when we were having that conversation, I said, have you thought about carer coaching? And so that's something also that we can, send someone forward to. So coaching isn't how do I say? Coaching isn't, it's more kind of getting that person in a space where they're able to kind of do something for themselves. So they're able to put those boundaries across and that sort of thing. So it's not counseling, but it's kind of just hand-holding a little bit to kind of get somebody from A to B if that's where they want to go, sort of thing. And then so we do provide information, like I said, but we don't give advice. So we're not licensed to do that. So what we will do is, for example, for money or debt advice and bits and pieces, we will refer to either like Citizens Advice or Step Change, or it would be like a free impartial service that we would give the information to carers that they could speak to those services about it. Some carers may need to speak to their local authority, for example, like if, their rent has increased and they can't afford it and they need a bit of help for a short period of time, they might be able to access discretionary housing payment and bits and pieces like that. So what we try to do is a full exploration just to kind of see where we can help. And it might not be something that we do in-house, but it might be somewhere where we can refer someone or signpost them to that. And next, what have I got? Right, so one of the carers that I've spoken to recently, so actually this one was with a household support fund. So before April, a household support fund closed in April, and that's now the Crisis Resilience Fund, although the criteria is slightly different to access that. So I spoke to a carer, and she was just kind of, she didn't know what to do. She had mold on her kitchen floor, and it's because her son, he's obsessed with water, and so they've been flooded a couple of times and that sort of thing. And she has to have the heating on to make sure it's drying out and all of these things. And she couldn't afford to replace the flooring. And the cooker also broke before Christmas. She couldn't afford to replace that. And that's something that we were able to help her to do. So we were able to make an application to the Household Support Fund to replace the cooker and to get some funding towards replacing the floor. So she got just under £1,000. And so she was able to kind of get everything sorted for Christmas. So it's those kind of things where there's a bit of a gap where the carer might not be able to find whatever they need themselves. We try to do a full exploration so that we can kind of say to them, you know, this is available or this is out there, and if they don't know about it and that sort of thing. So let's see, right, and to make a referral, so you guys can refer directly to us. We have a professional referral form on our website, and you can use that directly to refer. So we need consent from the carer to do that. We need and the personal details of the carer and the name of the person that they're caring for to be able to do that. And then so that's just our contact details, but that's on our website. And just an overview of the North. So I am Carer Funds wellbeing worker, but we've got different wellbeing workers within the team. So the stuff that we do, so we do hubs, so we're in different places, so Broadfield, Burgess Hill and that sort of thing, where we do hubs. The hubs are a drop-in, so carer can drop in to get information, advice, support, anything that they need really. And then if we're not able to kind of help them then and there, we'll take their details so that we can go back and get the information that we need to be able to book them an appointment and then get them that information. We also have face-to-face meetings, well, groups, carer groups, where carers are able to kind of come together. That's been really good for a lot of carers, where they're able to kind of speak to somebody that's in a similar boat kind of thing, and the person that understands, and it's kind of like a way, stepping away from their caring role for a short period of time. So that's normally good. We newly have a Chagosian worker. So she will be, she's based in Crawley, and she will be working with that community to make sure that people aren't isolated. A lot of times some carers don't see themselves as carers just because it's kind of like, oh, it's family, so it's what I do, you know, and that sort of thing. And if they register with us and that sort of thing, they're able to kind of access a lot more. We're able to give them support and that sort of thing. So it's useful. And then we do like wellbeing activities and wellbeing things with carers. Some are in person and some are online. So we do have like loads of groups and bits and pieces where the carers can't necessarily leave the cared for. So that will be like the dementia groups and stuff like that. So that will be online. But what will be useful, I think, for you guys is just to know that if someone's a carer and if they kind of feel like they need a little bit of support, they can always contact us, because what we'll do is have a chat with them, have a conversation, see what it is that they need, and then see in which way we can support them. And any questions? I'm going to assume that I just went through everything really well, so nobody has any questions.
Oh, it's really informative. Thank you so much. To know there's such a thing as carer training, you know, to help be, I guess, more proactive and assertive as a carer. Thank you for that information. It was really good.
Yeah, that's with our coaching team. So they will have a conversation, and it will be, they do in-person ones as well. So it could be in person or online, and they will help the carer to get to where they want to get to, sort of thing. So it's kind of, yeah. Fiona.
I asked the carer coaching sessions, roughly how many might you do with a carer?
I think roughly 6 sessions, but it will depend. So they will do an initial assessment, and then it will kind of be an agreed amount. So they will, if for example the person is kind of in a good place, but doesn't necessarily need a lot. It could be that they agree, oh, we'll do 3 sessions and then see how that goes. But I think roughly around 6.
Okay, thank you. And where is your Chagosian worker based?
Crawley. So she is in Crawley. And she's recently started, so she will be setting up her carer group, and that will be mainly for that community. So and she speaks Creole, she speaks French, so it's really good for the community because they're able to kind of feel like they're speaking to somebody that kind of understands them, you know, and that sort of thing. So yes, the groups haven't started yet, but she is going out and seeing people and signing people up at the minute.
Thank you.
I have a question, Stacey, if that's all right. Yeah, you mentioned that the Crisis Resilience Fund isn't as generous as the Household Support Fund, and there's a slightly different criteria. So could you just give us a little sort of comparison between the two? Because I'm not sure about that. It would be quite useful to know the difference.
So the main difference at the minute is that with the Household Support Fund, we had a pot of money. So we had some funding where we could distribute it to our carers. At the minute, we don't have a pot of money yet from the Crisis Resilience Fund. So that's probably going to be I think after the summer, we might. So in the meantime, we're referring to the to West Sussex County Council for carers to contact them. And what we found is that, for example, we have probably helped people a couple of times for certain things, and we've kind of tried to put things in place so that they won't necessarily need the fund all the time. But like you probably know, with energy and bits and pieces like that, sometimes people depend on it come winter time and that sort of thing. So at the minute, not sure what's happening around winter time as yet, but now it will be things that it will be a crisis that West Sussex will deem as a crisis. So for example, I've spoken to them, and if, for example, your car needs an MOT, but you can't afford to get the MOT done, but you need the car to help you're cared for or to go to appointments and bits and pieces like that, they will support you with that. But if your car needs an MOT, but you can't afford to have the MOT, but there isn't that reason why you need the car, it's just really good to have it in your household, then it won't be paid. So it has to be linked to a crisis.
Right. So what about things like like white goods? Like would that come under the Crisis Resilience Fund if something in the kitchen breaks down?
Yes, but what they'll do, they will want you to have explored other areas first. So for example, you could do through the energy company sometimes. So like Southeastern Gas, I think they do some white goods and bits and pieces. So they would want you to do an exploration first, and they're kind of the last kind of port of call sort of thing.
Okay, great. Thank you, Stacey. And Brenda, you've got another question.
Just to note on that, Southern Water also have a fund that could support people with white goods. So I think with the Crisis and Resilience Fund now, it is very much, you have to have demonstrated where else you've gone to have a look at the issues. You've had to have debt advice. You've had to, you're coming to them at the end of all the other avenues you've explored. Whereas Household Support Fund was, we're identifying that there's an issue there, we're supporting you while we're working through it. But Crisis and Resilience Fund is, you explore these other avenues first because they are there, and then if you don't get any success, then I think they're the port of call for that. So I don't know if they're currently doing white goods. Last I heard it was a no. But
I've had one person that had white goods from
lovely.
them. Yeah,
Yeah,
but
okay.
it was a unique situation because she was moving home and didn't kind of needed it immediately, so couldn't really contact other people to, so that it was kind of a need, and they saw that as a real need, so she got some help. But I know it's definitely strict kind of.
Yes, I think you've got to provide a lot more evidence for all the things that you've done.
Yeah.
And that's, again, energy companies have hardship funds. They have sort of levels of support that you can go and get some help from. That might just mean you don't have to go across to the Crisis and Resilience Fund, or they might, be able to give you something to say, we can't support you on this occasion, and that you could take to the Crisis and Resilience Fund. So, yeah.
I think one other thing to mention, if someone wanted to make an application to the Crisis Resilience Fund, it's something that we can support them to do. So obviously they can contact them via telephone, or they can use the form on the website. But if, for example, the person doesn't feel like they're able to kind of like speak for themselves sort of thing, that's something that we can support them to do. So we can help them with an application. I find sometimes people downplay their situation, and they'll be like, oh, I just need this. And the way you present it at first, it doesn't seem like it's a crisis, or it's necessarily that you need that right away. But when you have like a longer discussion and that sort of thing, you'll kind of realize, oh, no, you are in a predicament. You do need the help right now, even though they don't sometimes see it as, an emergency.
Great. Thank you, Stacey. Any other questions? No. Okay, thanks so much, Stacey. Well, we are waiting for our practice spotlight, which is the carer lead over at Southgate Surgery in Crawley. Her name is Lynn. She should be joining us to give us a little talk about how her surgery has collaborated with us on the primary care project, but she hasn't actually joined us yet. So I know she had an appointment with a patient, but she was due to finish at 20 past. So she said she'd join then. So what we could do, Anna, I've got the visuals that she sent over. I could just go through those and hope that she joins whilst I'm doing that. Do you think that will do? Right. So let me just share my screen. Let me get that up.
Just while you're sharing your screen, I'm going to say thank you, everybody, for listening to the energy advice. I put a few links in the chat. I'm going to exit now. I think the rest is not needed by me. So take care, everyone. Have a really good day.
Thanks so much, Brenda. Thanks for making the time today.
Thank you, Brenda.
Much appreciated.
Thank you. Bye.
See you later. We've got quite a small group today compared to normal, and a very quiet group. So I hope you're all doing well behind your screens today. You can tell it's that summer period where people are definitely starting to disappear over the holidays. Oh, Lynn has no invite, so that's why she's not with us. So if we pop that over to her, then maybe she'll join us now. Okay. You want to stop sharing your screen for a minute, Caroline, because you're showing everybody. Yeah.
Right. How strange.
While we're waiting, I think, so today we obviously focused on some areas of financial and broader energy support that might be available to your patients. We're aware we've covered so many topics over the lifetime of Caroline Learning Network meetings. It's been running for 3 years. It's quite a long time now. What would be great, and I know we're only a small company today, but if there are any topics that you would like us to cover, or any things you would like us to revisit, that, because obviously some of these topics we haven't covered for a number of years now. I think our first one was on caring with cancer, for example. If there's any topics that you would like us to focus on over the course of autumn and winter, can you just pop your thoughts in the chat or send us any comms after today about what you would find useful from these sessions by way of the learning element. So those speakers that we have come and speak with us on things that might be useful to carers and to your broader patient cohort as well. Hello, Lynn.
Oh, sorry
Thanks
about
for joining us. No worries.
Hi, Lynn.
Hello.
Don't know what
everyone.
happened to that invite. So
Well,
anyway,
it'll be
thank
me.
you.
Think of trouble. It'll be in the bin somewhere. Sorry about that.
Well, that's all right. No need to apologise. It's lovely to see you. So it's really good timing actually, because our other guest speaker has just finished a couple of minutes ago. So shall we jump straight into our little question and answer thingamajig that we have looked at? Right. So Lynn, do you just want to give yourself a quick intro, who you are, where you work, and then we'll start.
Hi, I'm Lynn Chandlar. I'm a care coordinator for ABC. I'm based at Southgate Medical and I've been here for 4 years. So work 2 days a week, 20 hours. And I take care of groups such as learning disabilities, veterans, carers, and obviously the normal awful quaff we all do. So yeah, bit of everything.
Great. Okay, so you've been very involved with the primary care project right from the beginning, actually. So we probably first met or first made contact back in 2023, I would imagine.
I think so.
And yeah, so you were quite new as well to your role back then, and there was quite a lot of carer related stuff that you were learning. I mean, you were just gathering information, weren't you? And so it all kind of coincided. You were new in your role. The primary care project was quite new in its development, and you jumped in right at the start, and you've made some really great progress since then. So could you just talk us through a little bit about what made you begin developing carer identification and support within the practice, if you can remember that far back?
Well, I came over from the airline, so I've got this sort of keenness to, be with people rather than computers. So I sort of pushed myself to take on carers because I noticed that in our sort of surgery, they were being looked after, but by no one in particular, and by no focus on one road. So I took over just before we met Caroline, and decided to push to see if I could bring in a coffee morning or something, just to try to get to know some of my carers, which was when we met. I invited quite a lot of people over to do, in fact, the first one, it was like, grab an organization. There was about 10 of you there, I think. It was really good, and everybody had a chat with the carers who came. It was quite well supported by carers, and it was really informative, and I thought, this is great, off to a great start here. And I learned an awful lot because I didn't know anything about support or signposting or any of these things that, since being with carer support, I've taken on board. So that one of the first reasons I began to develop the carer identity was, obviously, we had a register, but it was just basically a bunch of names. There was no format to how we recognise our carers, how we put them into categories of carers, because there's vulnerable carers, there's older carers, there's younger carers. And so my first sort of job was to re-establish the register. And on doing that, through the coffee mornings and the signposting to everyone, I got to know an awful lot of my carers.
Great. Yeah, I remember those days. Yeah, so can you tell us a little bit what steps you have taken to improve your identification of carers? You said you started off really with a social event and using the register with that. So what else have you done since then? How have you built on that?
So obviously the first thing was to get recognition for the carers. So the website was very poor. There was a one-liner on there about carers. So
I got the website changed, and now there's quite an informant page on carers. There's a registration form for carers, which I got put onto the website, so all carers can register, or register through the website. But if they can also phone up or speak to someone in the surgery and register. Obviously, we offered a package. We didn't offer anything. I don't think anybody knew what we could offer, because a carer is a carer. And so after speaking to yourself, I decided that maybe we should put an offer in of what we can offer. I mean, you know, it wasn't huge things, but it was things like extra time for appointments if needed. It was obviously being registered as the carer here, registering all of our carers that we know of with yourselves. So there was lots of things happening at that time to try and improve our knowledge and open it up more to carers here in the surgery.
Yeah, I remember having a very initial conversation with you at the surgery, and we were talking about a carer offer, and I remember your reaction was very similar to a lot of surgeries when we start talking about carer offers. I remember you saying to me, well, what's that? What can we offer? And I said, well, Lynn, you're part of the carer offer. Look, you're here really interested in carers. They just need to know who you are and what you do, and that you can offer them a bit of extra support. So that sort of got the ball rolling, didn't it, about ideas of what can be included in a carer offer.
Yeah, I think having a carer lead is very important, because, you know, obviously reception staff see so many patients every day. They can't really identify what needs are there for carers. But now I'm identified as the carer lead or the carer coordinator. Everything comes to me. So there's a focal point on me. The carers know my name. They know, a lot of them contact me directly. So having me as the lead initially and letting everybody know that, I think was a very important point. I mean, obviously we work with Toolkit that you sent over to try and make awareness in the surgery a lot better than it was. So yeah, I mean, updating our policies and procedures, you know, they were out of date. They were based, I mean, the website was initially based on the old policy and procedures. So once we updated the website and made this and put the offer on there, I could then update the policy and procedures, which was well overdue.
Yeah, great. So, do you know how many new carers you've identified at the surgery since collaborating with us with the Primary Care Project?
Well, going back to July 24, I think there was 185 registered, and I checked it this morning and there was 256. So huge improvement. I'm not saying they were all missing at the time. Obviously we get, as we all know, carers roll in, and you know, as they're looking after people, and unfortunately if that cared for person passes, then they come off the carers list and others come on. So I'm not too sure they were all missing, but I certainly am more proactive at finding carers where I don't think we were before.
Great. And is it you that does the coding for carers? I mean, do you get tasked, if say reception identifies someone, do they send that person over to you and then it's your responsibility to get them on the register, or have you got someone in the admin team that does that?
It's not a definite, you know, job role, but I always take on, because then I know it's done. So I'll get people to task me. Messages go out. I do them every so months to say, don't forget to task me if you have a new carer, because they need coding. So it's sent to me. I code them all. And also, obviously, through yourselves, we get a lot of people who are in our surgery who registered with yourself. And so that then comes to me. And then if they're not already coded and not as a surgery carer, then I will put them on as a coded carer.
Yeah, great. Okay, so you've really done quite a big piece of work around identifying carers. So you're very proactive at identifying carers. I know reception are looking out for them as well. So once you've got carers on the register, what steps have you taken to improve the support that you offer carers?
Well, we did quite a few coffee mornings, and then we decided, well, maybe I don't know if the other people here on the meeting, you find that you've got very keen people and you get the same people to your meetings all the time, and that's great. But they're not, you know, you've seen those people, and you're trying to bring in new people. You're trying to get everybody who really does need to be supported. So there's different communities, different cultures, different ages. You know, there's an awful lot of male carers who are very shy at coming forward for anything. Shy might be the wrong word, but reluctant to come forward as a carer. So, you know, I reach out to them. I get lots of advertising from yourselves. We have a notice board downstairs and upstairs in both waiting rooms. I have a carers notice board for itself. So we have a general notice board, and then I have my carers notice board. Lots of things that are going on. Keep it updated. You know, I collaborate with yourselves on initiatives. We do screenings for health checks, which I'm so proud of, because they have been the healthcare team have decided to reduce their surgery visits due to the fact that there's just not enough hours in the day, and they can spend that time better going into the community and doing it that way. But I pushed and pushed, and Liz and I decided that we could keep this one. So we do it once a month. So I make sure that I do get people in once a month for her.
That's Liz from the Carers Health Team.
Yes, the Carers Health Team. So she gives an hour to each patient. So, you know, it's an uphill battle to get everybody in. I do 3 a month. So, you know, it is an ongoing, but everybody who comes in, I ask for feedback. We have feedback forms on what they find, what did they find interesting, what did they find important, and what did they get out of it. So we can change it if we need to. Liz is amazing. She's a thorough nurse who goes through everything with them. Great rapport. So I think, and it's only once a one-off. It doesn't come every year or something like that. But because she can get into our systems, she can then signpost or refer or you know, get in touch with doctors for anything that's required for these cared for. So so that was another thing we did. Obviously, we offer free flu vaccinations. They're again seasonal, but a lot of carers don't realise they're entitled to free flu vaccinations. I'm just trying to think.
The training, the carer awareness
training.
Oh
yes, does that come in this category? Yeah. So after speaking to you, I thought, you know what, it's like a lot of these things, because I deal with learning disabilities as well, and a lot of they're very busy on the front desk. That there is no doubt about that. As we all know, there's always a queue out the door. So to give 5 or 10 minutes more to a patient when you've got another 20 waiting is quite hard to do. So we set up a training that was delivered by yourselves. I spoke to our manager and got it put onto the training scheduling. So it's an annual training. It's the same training, but we have it annual. So it's basically just a reminder to remind them of what, you know, awareness is so important. And we've also at the moment, which I'm still trying to push through, is to get it on for new recruits. So as we get somebody joining, in fact, we've had a new doctor join today. So I'm trying to get it put that they all do this on the ab initio. So they all come in and they do the training. I mean, awareness is 9/10 of our problem, isn't it? Really, if we are just more aware of their needs, then it makes their life easier, and it means that we can help them much easier because we know what they're actually looking for.
Yeah. Wonderful. So have you, I mean, can you see any early benefits or outcomes of the work? And, you know, what benefits have you seen from all of these steps that you've actioned?
I do get a lot more. Oh, Lynn, I had someone at the desk. Can you just check them? You know, so I'll come down, have a word with them, find out that they do care. And again, it's mainly men that I found who haven't registered with us who are carers, because they go, well, you know, I'm just looking after my wife, and you know, and they go private and they don't want any help, but they just, and I just feel as though that if they know we're here, and especially if they can put a face to a name, which is me, and if they do need me, then I'm here. So I think a lot more awareness of looking for something that's not obvious, by the reception staff has come out of this, very much so. Clinical side, I'm not too sure, because I think they have their own way of recognising things. But I think the training that came from you that we give to both our admin staff and our reception staff was needed to make awareness of the needs of carers much more obvious.
And even if, you know, just as a result of the training, then all patient-facing staff will have that little spark of awareness. Oh, this person's in a caring role. I can refer them over to Lynn, and then you can just pick up that carer. So it's just having everybody, kind of everyone in the surgery, aware of what to look for and what to do when they come across someone that's in a caring role.
I think before the training, I think it wasn't an uncaring relationship reception with the staff. It was that they didn't know, and what you don't know is it's not a dangerous thing, but you can miss things. So once we did the training and that awareness was there of what to look for, and there's a lot of carers who are very vulnerable, as well as the people they're caring for, because it's a stressful, frustrating, you know, time-consuming, thankless role, really. So I think it's made everybody in the surgery who are front-facing staff more aware of looking at, you know, I got I think we spoke yesterday, Caroline, as we got a telephone call from a chap downstairs in reception wanting some painkillers, wanting more painkillers. And so the receptionist said, okay, yeah, what have you done? You know, he said, I broke my pelvis. And she said, oh, that's terrible, you know, and they got chatting. He was on the phone and he sort of said, well, yes, because, you know, I care for my wife, and I you know, and now I broke my pelvis. And he said, but it'll be fine, because I just need more painkillers and everything will be fine. So on that, Jane then directly got in contact with me to say, I'm really worried about this guy. You know, he's not young, he's elderly himself, he looks after his elderly wife, and now he's not mobile. He's got nobody else. And so what can we do for him? So nothing, you know, in the system works quickly, as we all know. Everything, you know, everything takes to be assessed. And so, you know, I pushed and pushed with the adult care, who are going out today, I think, to assess him. And it is just temporary, but he was very embarrassed about taking this help, you know, because he felt it was for him. But without that initial recognition of reception, he would have ordered his painkillers, come off the phone, and, you know, no one would have known anymore. So the training has worked, and the fact that we do recognise sort of, you know, the spoken words, the visual things, we, you know, reception do notice those things now.
Oh, that's a great story. Thanks for sharing that, Lynn. So what are plans? What's coming next for your carer support role?
It's like the fourth bridge, isn't it? It's never normally ever finished. You sort of start with one and then you just get that done. And so, as I said earlier, you know, I've got learning disabilities. I've got about 145 learning disability patients. Which, you know, I look after as well as I do my carers. And recently, I've just taken on veterans. So I did a veteran course last week, which was a very long course. It was 6 hours or something, but it was very interesting. And after that course, I sort of sat and thought about it, because I've never put anybody in boxes, but I've always thought about carers being, you know, looking after elderly patients, dementia patients, you know, maybe cancer patients, frail patients. But actually, that umbrella is huge, and it's not necessarily a carer is not necessarily looking after somebody who is terminally ill or poorly. I mean, with the veterans, they've all mainly got carers who are family members, like wives, because they have PTSD. They have amputees. We have, you know, depression, you know, alcoholism. We have all these things in one group of people, which are veterans. And then in the learning disabilities, we have people who most of them live a normal life, but need a support network. And so they have carers, but they're not actually looking after them on a daily basis like you would if you had a dementia patient. So I've now started to use the register a bit differently, and I'm looking at a wider range of where we can pick up our carers, because it's amazing. When we think of carers, we think of people who, well, I did, thought of people who were mainly in need of constant help from a relative, an informal carer, whereas actually sometimes it's just support, and sometimes, you know, it is your child who's maybe even living on their own, but they just need help with form filling, shopping, washing, but they're actually living on their own, but they're still there in the stress of that. And a lot of my initially, a lot of the health checks that I did with Liz, they were coming from learning disability carers because of the stress that these people were under of letting their relative, being a son or a daughter or whatever, living a normal life, but having to be there to watch them the whole time. So it's a huge, you know, it really is a huge umbrella of people for carers. So that's my next mission, is to try and bring a lot more of my registers that I deal with and put them all together as carers.
Linking up the registers, yeah, that's a great plan to have. Thanks so much, Lynn, for sharing all of that. I'm just going to share my screen because you sent over some really nice little visuals, which we can just really, we've only got a few minutes, but we'll just click through.
Oh, so yeah, so this was so these were done, this is the policy, the front page of the policy statement on carers, and basically you know, we identify and record all carers. I'm sure most of you will have a similar thing on your policies, and who are carers, identifying you know, that's not just a particular age, but it's if you're a carer as an informal carer, or there's a professional carer.
Yeah. So you've got who are carers, you've got a nice little definition there, significance of identifying them, you've got some great links in here. That's, yeah, so that's your carers policy, and then we're down here. So what's this one?
So this one's on the website. So when you go into the website and you press on us, and it comes up with carers, it tells you, I had the terminology here changed because we used to write, I think as many of us did, are you a carer? And, you know, if you're a husband looking after a wife or a daughter looking after a mother, you don't class yourself as a carer. So we had the terminology changed to, are you looking after someone? And I think that was again down to the toolkit, looking at other ways to try and encourage people to read first, and then maybe give us a call and link in. So this is on our website.
And so there's the offer, basically.
So there's
that's
the offer,
your carer
offer.
Yeah.
The free flu jabs, the screening of health checks, flexible appointments, dedicated care support, and referrals to other local services and partners. And then I don't think I gave you the next page, or did I? Oh yeah, and then we've got a link to lots of different yeah, and that's again, that's what they would find on a web page.
So that's really, that's on the website. So that's carers can self-identify, read that and think, oh yeah, well, I do look after someone. It never occurred to me that I'm in a caring role. So that's really great. And then they can go and inform themselves about these things that might be relevant for them. And then the last one, this was just, I think, oh, this is your carers registration form. Is this on the website?
So yeah, you can fill one in on the website, but we also have these in reception. So if people come in and they want to register as a carer, then it can be done there and then at reception. It's a similar one that's on the website, and basically then that gets sent to me for coding. So then I code them onto the register, and they become one of our carers.
And then the last one, this was your coffee morning feedback.
So when we did the coffee morning, you know, I always find feedback is so important, because it's the only way you can go forward with either good responses or bad responses. You need to have a mixture to know how to keep, you know, improving on what you do. So between us, we got this done, and then I think I sent you some copies over because you were involved in this. And basically it's just asking, was it too long? Was there enough information in it? What other formats do you think, you was the information we gave you too much, too little? But I also had from one of the coffee mornings, would you be interested and need a carer support group? We didn't get many people take. I think they're all so busy doing the caring side of it that not many people took us up on that. But we did try to do a WhatsApp group, which I thought was a great idea to link other carers with other carers. But unfortunately, due to the demand on my time by the surgery, my boss decided that we really needed to cut back on the coffee mornings, and so we never really got into that. But that's something that's on my to-do list. I think carers knowing carers and can go on the WhatsApp group and support each other is as important as we are here, really, or if not more important.
Fabulous. Thank you so much, Lynn. Oh, we've got 1 minute to finish. That's really appreciated. Thank you for joining us. Thank you for sharing. Does anyone have any questions for Lynn in the last 30 seconds of the meeting? Got a very quiet group.
Oh, that's good.
You're off the hook, Lynn. Okay. Anna,
well, you,
is there anything else? You're welcome, Lynn. Is there anything else you'd like to add, Anna? Or
no, what I would like to add is that you two, this is great. I love this. Where we all get together and share each other's experiences and share each other's knowledge. I've taken a lot away from this, especially from your speakers and from other inputs from other people. So thank you too for this, because it is really worth it for us. Well, for me in particular.
Well, thank you. I've been asking Lynn to practice Spotlight for 2 years and I finally managed to nail her down. So it's much appreciated, Lynn.
Thank you very much.
If there's nothing else, thank you so much, everyone, for attending. We'll be sending out follow-ups, updates, invites to the next one. And if anybody would like to contact us, please do. We're here for baseline reviews. We're here to talk you through the toolkit. So anything you need with regards to carer support or wider support that's available, then please do get in contact. Would you like to say anything, Anna, or just goodbye?
Thank you for your time and have a lovely summer, everyone. We'll see you. It's in September, I think, our next one.
See you in September is the next one. Yes. Okay.
Thank you.
Thank you, everybody.
Thank you. Thank you very much. Bye-bye.
Thanks. Bye.